Okay, hello everybody. My name is David Delvo, and I work for Clarion Psychiatric Center, which is in Clarion, Pennsylvania. We are a 112-bed inpatient psychiatric center in Clarion, Pennsylvania, serving kids, adolescents, and also adults. We have a lot more information for you on our website, clarionpsychiatriccenter.com. And please feel free to go there and get all the information that you need about Clarion. All the information is on our website with our admissions, transportation, and all information on the hospital. Also on our website are 4 of our trainings that we do. This is one of them, our vicarious trauma, taking care of yourself. And we also have 3 other trainings on there that you can download. One is trauma-informed care. The other one is suicide prevention. And we also have one non-suicidal self-injurious behaviors. Those are our 4 main trainings that we have on our website. We do offer more trainings. I believe we offer 10 altogether, and that is part of my job as well, going around the state of Pennsylvania and providing these trainings for providers. All the trainings are free. I come to your facility and do those trainings as well. So if you would ever need a training done at your facility, you can email me and I'll provide you with that email at the end of this training. Just to give you a little background on myself, prior to coming to Clarion, I worked at the Watson Institute, which is a school for kids with autism, for about 10 years. I was the director of their community-based instruction program. And while I was there, I went on to get my master's in counseling, where I then worked at Poetic Counseling Services for about 15 years, doing outpatient therapy, some behavioral specialists, some mobile therapy, and then I have been at Clarion now for about 5.5 years. So today's training is vicarious trauma. A lot of people, sometimes when I do this training, they're like, I don't even know what vicarious trauma is. Vicarious trauma is trauma that can happen to you over a period of time while working pretty much in the mental health field, first responders, things in that nature. So things that we hear from our patients, things that we see, their trauma can become our trauma. And eventually you can reach the burnout stage. You can reach that secondary trauma stage, and you can also have compassion fatigue. And we're going to talk about what each and every one of these things are, and then ways that you can take care of yourself. Because if you can't take care of yourself, how are you going to be able to take care of the clients that you serve? So that's the main part of this training. And if you have taken the trauma-informed care training, you can kind of skip over the first part of this training because we touch on trauma, because without trauma of others, vicarious trauma would not exist. So we do touch on about that for the first 20 minutes of this training. So feel free to go down to the start of the vicarious trauma part if you have already taken the trauma-informed care part. So let's get started here. This training is about an hour and a half long, so please feel free to stop it at any time. You can take a break, you can get up, you can walk around. That's what's kind of nice about trainings that are posted online. You can stop them at any time. So please feel free to do that. Just some of the goals and objectives that we will be talking about today. Like I said, we're going to do a basic intro to trauma, pretty much trauma 101. And then we're going to define vicarious trauma and the 3 different types that can occur, which are burnout, compassion fatigue, and also secondary trauma. And then who is at risk for vicarious trauma? We're going to talk about risk factors. We're going to talk about signs and symptoms that you can recognize in yourself, but also in your coworkers as well. And then usually in my face-to-face trainings, we do the professional quality of life scale. We will not be doing that today, but feel free to download that and take this test. It really shows if you are in danger of compassion fatigue, if you are in danger of burnout, and if you are in danger of secondary trauma. So if you just go into Google and type in professional quality of life scale, click on it. I believe it's a 25 question test, and then you have to score it at the end. So it's a pretty good test. I take it. I'm not ashamed to say that because I've been in this field for over 30 years now, and I'm a more visual person. So, if I see that I'm getting close to any of these areas, that I can take some time out for myself and use some coping skills that help me get back on the right track, okay? And then we're going to talk about some self-care techniques that you can use. And sometimes when I do this training, people are like, it just can't be that easy. But sometimes it is. You forget about the things that you once enjoyed that you don't do anymore, and we kind of take you through that, and it does help. And then how organizations can prevent vicarious trauma, and we'll go over some of the ways that Clarion Psychiatric Center does with our employees to prevent this burnout, this vicarious trauma stage. Okay. All right. So, guys, I just want you to think about for 1 second, what is trauma? Kind of come up with a definition in your head. What is trauma? There's no right answer. There's no wrong answer. Just whatever you think trauma is. Oops, skipped a slide there. Sorry. Okay, so we're going to start with the risk continuation form of stress to trauma. So our bodies, there's 3 different types of stress that our bodies endure. And the first one is our normal developmental stress. That's your everyday stress. Maybe waking up in the morning, getting dressed for work, thinking about a project you have to do, getting the kids off to school, thinking about all the things that you have to do for that day. That's pretty much normal everyday stress. And we have the coping skills to deal with that. And usually that normal everyday stress will pass and will go away. And then we have situational stress, where situations that can pop up throughout the day that can cause our heartbeat a little faster, maybe cause us to sweat, and in some cases maybe cause an anxiety attack, a panic attack. But we do have those coping skills to use during situational stress, and usually that situational stress will pass. Just an example of situational stress, and I'm sure we've all been there. Working in this field, I'm sure there's situational stresses that pop up every single day. But say you have a big meeting that starts in half an hour. So you get into your car, you're pulling out of the driveway, You're going down the street and all of a sudden you get a flat tire and you're like, oh no. And then you go to reach for your cell phone and you forgot your cell phone at home. So there's no way that you can call anyone to get that tire fixed. That's situational stress. That can cause your stress levels to rise. But usually that will pass, using our problem solving skills, things in that nature, that will pass. And then we have people that have traumatic stress. And we all know that working in the mental health field, a lot of our patients that we see are dealing with some type of traumatic stress. And stats show where 90% of people with a mental health disorder have had some type of traumatic stress. And their traumatic stress can become your traumatic stress. And that's what vicarious trauma is, okay? Usually traumatic stress, we don't have the coping skills to use. And in a lot of situations, that traumatic stress does not go away. People live with traumatic stress for weeks, for months, and even years. And we'll talk a little bit about that more here in a second, okay? So that's just the stress continuum and 3 different types of stress that our body endures, okay? So our bodies are designed to handle stress, okay? So when we're under a traumatic situation, when we're under traumatic stress, our brain kind of shuts down and it puts us in that fight, flight, or freeze stage, okay? So when we're under severe stress, our bodies are either going to fight our way out of that situation. We're either going to stand there and freeze and not sure what to do, or we're going to run. A lot of times, we see on TV with school shootings or community shootings, where people are running, they're trying to run from that situation. So that's where the fight, flight, or freeze stage comes in when we're under traumatic stress, okay? And this is just a little thing I put together to kind of sum that all up. When we're in a calm state, when we feel safe, the amygdala part of the brain can communicate with the leader part. So when we are under that normal developmental stress, when we are under that situational stress, that amygdala can communicate can communicate with the leader of the brain and kind of make good decisions for us, which causes that stress to pass. But when we are in traumatic stress, that amygdala cannot communicate with the leader of the brain, which automatically puts us in that fight, flight, or freeze stage. Okay, and like I said, we're gonna touch on this a little bit more in detail here in a minute. Okay, so what is trauma? You can tell when somebody is in a traumatic situation or under severe trauma. Just look at the gentleman here on the top right corner. Just by looking at his face, he is under traumatic stress. He is angry. He is upset. He is in some type of rage. He can be in that fight stage of trauma. And then we look at our woman here who is in the Army. She's definitely going through something traumatic. Maybe she lost a loved one. Maybe she lost somebody that she was close to. Maybe she's dealing with some type of hard time, but she's definitely under traumatic stress. And then our bottom picture shows this child. And it's funny when I do this training, because when I talk about the gentleman and then I talk about the woman, I say, so our next picture, how do you think this child is feeling? And usually the whole room will go, oh my gosh, look at this poor little girl. So we tend to have more empathy for kids that are going under a traumatic situation. Maybe we have kids of our own. Maybe we work with kids, and we do tend to have more empathy for children. Look at that little girl. She could be, sadness, fear, hopelessness, things in that nature. So you can definitely a lot of times read somebody's facial expressions if they're dealing with a traumatic situation. So what is trauma? An experience that produces psychological injury or pain, affects emotional, spirits, emotional, and well-being, involves loss, serious loss, threats, or harm, and it causes us to wake up in fear. It causes us to live our lives in fear. It causes us to maybe distance ourselves from others, distance ourselves from activities, live in isolation because we don't want triggers. We don't want to experience triggers that can cause us to relive that trauma experience all over again. Okay, so trauma is feeling afraid, feeling unsafe, like you're always in danger. You're sad all the time, feeling of helplessness, waiting for that next bad day, that next sad day. Like I said, it just causes you to wake up in fear, and not be able to live your normal everyday life. Okay, so trauma is determined by two different types of events. Okay, there is acute trauma, which is one single event that can cause somebody a traumatic experience, and then ongoing trauma, which is chronic trauma, complex trauma, and these are situations that can occur numerous times over a long period of time. And the ongoing trauma, the chronic trauma, the complex trauma, these are the types of patients that we usually see if we are working in the mental health field. So acute trauma, just by looking at this picture, everybody, I am sure, can guess what this picture is. It's 9/11, which is probably the most single event that has caused the most trauma. Not only for our first responders that were there, not only for the people that were living in New York City at the time, but think about, I'm sure we all can remember where we were when 9/11 hit about 18 years ago. I was in my house, I was doing dishes, and I heard the news come on, and I just started to watch this. It just seems like yesterday that this event happened. Trauma can happen for people like us who are watching it on TV. My daughter was not even born yet when 9/11 happened. But all the stories that she read, all the movies that she sees in school, caused her trauma. She was afraid to go into the city of Pittsburgh. She was afraid to go to Cleveland because she thought buildings would crash down on her. So she was not even born, but this event caused her trauma. So these are just some. My clicker's not working. So these are just some acute trauma situations, and this list can go on and on and on. It's whatever the person experiences trauma, whatever that situation is. So school shootings, terrorist attacks. Think about all the natural disasters, earthquakes, floods, tornadoes, hurricanes, fires, things in that nature. Serious car accident. To give you a little story about this one, I was in a severe car accident about 15 years ago. I was driving down Interstate 80 to go to a friend's house in Brockway. and it was a snowy night, very dark night, and I was with a friend of mine, and we hit some black ice on Interstate 80. The car spun around. We ended up rolling the car 2 or 3 times into the berm of the road, and landed upside down. It was dark. We couldn't see. Thankfully, a gentleman that was behind us stopped and called 911, and we had to be removed from the car through the jaws of life. I sustained some serious injuries during that accident, but even though that accident happened 15 years ago, with my job, I travel a lot. I live in Grove City, PA, and Clarion is in Clarion off of Interstate 80. So a lot of times I pass my exact spot where I had that accident, and that can be a trigger for me. You know, even though it's a sunny day, it's 80 degrees out. When I'm approaching that accident spot, I grip the wheel a little bit tighter. I have to turn on the air conditioner even if it's in the wintertime because I start to get hot. And it just makes me relive that experience all over again. Sudden loss or violence of a loved one, a divorce, suicide of a loved one, workplace harassment, bullying. Now, some of these can also be complex trauma. Bullying can, happen many times over a long period of time, but it can only be a one-time deal as well. So these are just some examples of acute trauma. And then we have chronic trauma, complex trauma, where multiple events happen over a long period of time, like physical abuse, sexual abuse, neglect, things in that nature. And these are just some examples of chronic trauma. That physical abuse, domestic violence, war. And let's go to vicarious trauma. This is a chronic, complex trauma. It happens over time, and it will take a toll on us. Like I said, our clients share with us stories of fear, things that have happened to them. They share their traumatic experiences, and I'm sure we have seen things in this field that causes like a permanent picture in our mind that we cannot delete, and that takes a toll on you. So vicarious trauma is a chronic, complex trauma that happens over time, and that's what we're going to talk about today. Okay, so I just want to touch on the brain and trauma. I heard a woman speak. It was about 3 years ago. Her name is Jane Deannabelle. She resides in Texas, and she came up to, I believe it was Newcastle. She has 30 years of experience working with trauma and the brain and trauma. And a lot of what she was saying really didn't make sense to me. She was using these big words, and I'm not a neuropsychiatrist or psychologist, and a lot of it went over my head. But she did pull up these 4 slides that brought it down to my level and really made sense in what the brain goes through when you're dealing with a traumatic situation or triggers to trauma. So that's what I'm going to talk about here. It puts you in the person's shoes of what they're going through when they're dealing with a traumatic situation. Okay, I'm going to use my pointer here so everybody can see. So this is a normal brain, okay? This is a person that does not have any stress, okay? So we're just looking at that synapses part of the brain, which is a very small piece of the brain, which controls all of our chemicals, okay? And our chemicals are a big part on on how we deal with anxiety and how we deal with stress. Sometimes our chemical imbalance can get out of whack, which can cause depression, which can cause anxiety. But there are medications out there to bring those chemicals back to a normal state. And you're going to see that here in a minute. Okay. So this is maybe a person that is retired. Maybe this is a person that probably does not work in the mental health field. But this electrical current that is coming in, this is the electrical current that is coming into the brain. So this is things that we are seeing, things that we are witnessing. These are our surroundings that's coming into the brain. So the signals that come into the brain, okay, produces these presynaptic vesicles right here. Okay, and if everything's going well and there's no stress, it fires these neurotransmitters into the synapses. Okay, it fires just enough to keep that chemical imbalance or that chemical balance, and then these neurotransmitters attach to these postsynaptic receptors, and that sends out signals to our brain on how we are feeling. So this person, no stress, they're probably calm, cool, collective, nothing really going on. Okay. And then you come to a person that is undergoing some type of trauma. Okay. So this brain is under severe trauma or under severe type of stress. And you can definitely see the difference from a brain that is under no stress to a brain that, is having trouble with my clicker, to a brain that is under traumatic stress. So you have the electrical current coming in, which is that traumatic experience. Okay. They could be witnessing a traumatic event, or they could be the victim of a traumatic event. Okay. So as that is coming in, it's attaching to these presynaptic vesicles. So these presynaptic vesicles are saying, holy cow, something is not right. Something's wrong here. So it starts firing all these neurotransmitters into the synapses. So there's not a lot of these postsynaptic receptors to handle all these transmitters. Okay. And this is the fight, flight, or freeze stage that somebody goes through when it's dealing with trauma, because the amygdala cannot communicate with the leader part of the brain because of all these neurotransmitters. So it's going to put you in that fight, flight, or freeze stage. So this is a very dangerous part of trauma. Think about a time where you were nervous. Okay, think about a time when you were really stressed out. Maybe you had to do a big presentation at work. Something in that nature. How did you feel? I'm sure your muscles tensed up, maybe sweating a little bit, maybe headaches. Maybe your heart was racing real fast. When you're stressed out, you don't feel that well. Somebody that is in this stage of trauma can be in this stage for a long period of time, can be in this stage for weeks, months, and even years. So imagine living like this for a long period of time. Well, this can take a toll on your body, both mentally and physically. So if you don't have the proper coping skills, okay, to deal with it, what are a lot of people going to turn to? They're going to turn to drugs, they're going to turn to alcohol, and they're also going to turn to self-injurious behaviors in this stage. Something to get their mind off that emotional pain and put it on that physical pain. So it's a distraction, okay? So when the brain is in this stage, it says to itself, I need to turn this down. I need to turn it down. I need to get out of the stage. So if somebody does, use a negative coping skill such as drugs and alcohol, once that drugs and alcohol wear off, the next stage can be you feel flat and you feel numb. And as you can see with this, there's really not a lot going on in here. The electrical current, nothing coming in. These presynaptic vesicles are shooting really no neurotransmitters in the synapses. There's no neurotransmitters to attach to these presynaptic vesicles. So this is a person that kind of just walks around in that zombie state. Shows no facial expression. When you talk to them, it's just that flat monotone voice. Okay. So this stage can also be a very dangerous stage, because when you're in this stage, you want to get out of the stage. You're tired of feeling flat. You're tired of feeling numb. You want to make sure you're still alive. So self-injurious behaviors can occur in this stage as well. People will actually self-harm themselves to see the blood, so they know that they're still alive. They know that they're still living. And people will turn to drugs and alcohol in this stage as well. So, let's not judge somebody by, maybe they're a drug user, maybe they're an alcoholic, maybe they're a self-harming behavior. We need to know the full reason why they're doing that, because doing those things is maybe just a coping mechanism to help them deal with that traumatic experience. Okay. And then our last stage of trauma, which is our triggers to trauma, which is very dangerous. Okay. Even though a traumatic experience happened 15 years ago, let's use myself as an example. My car accident. Every time I drive on Interstate 80 and I see the Clintonville exit, I know I'm getting closer to my accident, and I have flashbacks. I can see myself spinning around. I can see myself flipping. I can hear the sirens coming, the noises of the jaws of life trying to cut us out. Triggers to trauma makes you live that experience all over again. And a lot of people will avoid triggers to trauma. They'll isolate themselves. They won't do things that they once enjoyed because they're afraid of those re-triggers, those re-triggerizations to trauma. Okay. So kind of makes sense, everyone. It did for me. It kind of really put it in perspective on what the brain goes through and what somebody's going through when they're dealing with a traumatic situation. Okay, so we're just going to briefly talk about the ACEs study, the Adverse Childhood Experience Study. This was the longest study ever done on childhood trauma. It lasted over 14 years, and it involved almost 18,000 people. So what they would do is, as people were coming in to this healthcare building, they were handed a survey to fill out. And they were asked 10 questions. And the questions were, there were 3 different types of abuse. Were you sexually abused, physically abused, or emotionally abused? 2 different types of neglect. Were you physically neglected, or were you emotionally neglected? And then 5 different types of family dysfunction. Having parents who were treated violently, having a household member who's an alcoholic or a drug user, who's been in prison in your family, your mother, your father, your brothers, your sisters, who was diagnosed with a mental illness, and whose parents were separated and divorced. Okay. And these are some of the results that they found through this study. No, they did not target any certain population that walked into the building. They just handed them out randomly. And this is the percentage of people that actually filled out the test. So as you can see, there's no different type of population that was targeted. 74% of those people had attended college. Okay, about 50% of them women, 50% of them men. Okay, and then this just breaks it down number-wise through the study, and you can kind of go over these on your own. But I really want to target this one. Okay, so the higher score on the ACEs study, the more trauma that you experienced. Okay, and what they found through this ACEs study was multiple ACEs study connected to early death. So people with a 6 or more ACEs score died nearly 20 years earlier on an average than those without an ACE score. So those without an ACE score, their average lifespan was about 80 years old. Those that scored 6 or higher on the ACEs study, their average lifespan was 60 years old. So you can see where untreated trauma can have a very serious toll on your body, both mentally and physically. Okay. And, the reason for this: severe and persistent mental, emotional problems, those high risk behaviors, the drugs, the alcohol, things of that nature, suicide attempts and self-harm, big time when it comes to trauma. I'm not sure if I have the suicide attempts. Yes, this is what I want to look at here. So 60% of all suicide attempts. Okay, 64% of adult suicide. So I really want you to look at this last one. 80% of child and adolescent suicide attempts. I want you to think about, why do you think that number is so high? Oh, I really can't hear you, so I'm going to tell you. It's sad. Okay, say you have a child that is in a home where the parents are the ones that are doing the verbal abuse, the physical abuse, the sexual abuse. Who do these kids turn to make them feel safe, to make them feel loved, to make them feel wanted, to have their needs met? They have nobody. They have nobody to turn to. So all that emotional pain builds up and up and up. And a lot of people would rather end their own lives than keep on living with that emotional pain. So kids and adolescents don't have that support. They don't have, maybe they were never taught coping skills, positive coping skills. They have nobody to turn to when they're afraid. They have nobody to turn to with advice. So that's why that number is so high, and it breaks my heart. All right, prevalence of trauma. This is just some stats related to trauma. Like I said, 90% of the public that has a mental health disorder has had some type of traumatic experience. 90% of homeless women have had severe trauma histories. And if you ever want to watch a documentary on trauma, please, you can either buy it, you can buy the full video, which is an hour long. It's called Healing Need by Tonier Kane. Tonier Kane did the ACEs study, and she scored 10 out of 10. She was physically abused, sexually abused, verbally abused. Her mother was an alcoholic. Her mother was divorced. And Tonier Kane was incarcerated. I believe it was 86 times for prostitution, for drug use. And now she is the director of a trauma-informed care agency in Baltimore, Maryland, and she tells her whole story. It's a very powerful documentary, but you can also download on YouTube, Healing Need. I believe it's a 27-minute, and it's good. It touches on the main parts of the hour-long video. So please, if you get a chance, watch that. She puts it really in perspective on what she was dealing with. She doesn't blame the drug use. She doesn't bring the alcoholism. She said that that was all a coping mechanism to deal with her childhood trauma, but nobody could understand that. Nobody asked her, what happened to you? Everybody would ask, what the hell was wrong with you? You know, so she tells that story. She tells that story as well. So please, if you ever want to watch a documentary on trauma, it is called Healing Mean, and it is by Tonier Kane. Okay, a lot of you may have seen that already, but if you haven't, please please download that and watch that. Okay. All right, guys. So that was our brief overview of trauma. So without a person's trauma, vicarious trauma would not exist. Okay. So this is what we are going to start to talk about now. Our vicarious trauma. So it all starts with our professional quality of life. How happy we are at this moment, how happy are we in our jobs, how happy we are in our family situations. Okay, so you have the left side, which is the compassion satisfaction. So you're a pretty happy person. Okay, you're happy with your family, you're happy with your job. The supports around you are there. And then you go to our left side. Okay, and this is where you are compassion fatigued, you are burned out, you have hit that secondary trauma. And we're going to talk about each one of these. Okay, so that's just our professional quality of life. So what's the difference when it comes to burnout, compassion fatigue, secondary trauma? So think about it for a second. I'm sure many of us, all of us even, have always said, I am burned out. I am so burned out. But what does that actually mean when we're burned out? You're emotionally exhausted. Maybe you've been working 80 hours a week. You've been working, maybe if you work in a hospital, you've been working, double shifts. First responders, you're working those double shifts. You haven't had a vacation in weeks. You're just emotionally exhausted. Reduced feeling of that personal accomplishment. You don't have that anymore. You don't feel like you accomplished anything. Sometimes you start to question yourself, like, why am I even doing this? Why am I even doing what I'm doing? Because you don't get that personal accomplishment feeling from your job. And it develops as a result of general occupational stress. So it comes from your occupation. Okay. Results in the work environment and workload, okay, rather than the exposure to another person's trauma. So burnout is not that exposure to another person's trauma. It's just the long hours that you work, maybe your work environment that you're in, and the number of days that you work. Okay, it has nothing to do with that exposure to another person's trauma. And it occurs over time. You just don't wake up one day and say, oh my gosh, I'm burned out. Okay. It happens over time. It happens over a long period of time. And usually, when you hit that burnout stage, but we're going to talk about warning signs, risk factors for that burnout stage. And then our compassion fatigue, a state of tension and preoccupation with individuals or cumulative trauma of clients. Okay. Now, I like to look at compassion fatigue going two ways. Okay. I like to look at it first as, we wouldn't be in this field if we didn't want to help others. And sometimes you get so involved in helping the clients that you serve that you tend to you forget to take care of yourself. Okay. And you would rather take care of the clients that you serve than take care of yourself. Then also it could go another way where you've hit that compassion fatigue stage. You just don't care anymore. You don't have that compassion for the population that you work with. So if somebody is telling you a story about what happened to them, you have no compassion for them. You're like, oh, the hell with you, suck it up, get back to your work. I can't help you with that. So it can go both ways. Then let me give you a story about my grandparents. So my grandparents both came over from Italy, and they were your typical Italian family. My grandfather was like 6'4", and my grandmother was a tiny Italian lady, like maybe 5'3", 5'4". And my grandfather owned a produce yard down in the Strip District. So every morning he would get up, he would go take the trolley down to Pittsburgh, work, 10, 12 hours a day. And, my grandmother would stay at home. She would clean. She would make sure she had dinner on the table for him. So her job was to pretty much take care of him, and his job was to take care of the family financially. So what happened was my grandfather got sick. He became a diabetic, and he had to get both of his legs amputated because of the diabetes. So he could not go to work anymore. So my grandmother focused her life on taking care of him. Now, when she was taking care of him, she forgot to take care of her own needs. She became sick, and she actually passed away before he did. So that's where we can get into trouble. We have to start taking care of ourselves, because if we can't take care of ourselves, how are we going to take care of the people that we serve? Okay. And compassion fatigue can have eating problems. Sometimes when we're so stressed out, a lot of people eat when they're stressed out. I'm the total opposite. I cannot eat when I get stressed out. My stomach just doesn't feel like eating. You lose that sleep. Your mind just starts racing, and you start thinking about your clients, and you just can't sleep. And it has a serious effect on family and friends as well. Okay. And then that secondary trauma is the transformation of their trauma over to you. Okay. So their trauma becomes your trauma. So that's that secondary trauma. So that's kind of the difference when comparing those three. Just to give you an idea of what it is, I thought I know a lot of people are visual learners. I'm a visual learner. As you can see from this picture, I am not an artist. I'm a good artist when it comes to stick figures. Okay, so you look at that left side. You have the direct trauma. You have post-traumatic stress. If ongoing post-traumatic stress is not, if you don't get the help that you need, it can become severe. So you look to the right side, okay? The vicarious trauma, that's secondary trauma. So this is a trauma clinic, okay? So you as a clinician, or you as a mental health provider, okay, this is you, can be listening to these stories that our clients tell. Okay, and you can develop that compassion fatigue for them. You can develop that secondary trauma. Now, especially when you yourself have experienced maybe that same traumatic situation. Okay, so if you are a clinician and you were in a severe car accident, and you have severe traumatic stress over that accident that you have not dealt with. Imagine you sitting here listening to a person that was in maybe the same accident that you were. That can be very traumatic. Okay, so in a lot of cases, You as a clinician, if you have not dealt with your own traumatic experiences, how are you able to help those with traumatic experiences as well? Okay, which is very important because you can hit that burnout stage a lot quicker if you haven't dealt with your own trauma experiences. And then this is the burnout stage, guys, okay? Emotionally demanding. So we know a lot of these providers, they provide services, 6, sometimes 7 days a week. Think about our hospitals, over 1 billion served. We're open 24 hours a day, 7 days a week, anxiety clinic. We never close. So you have clients coming in one after another, after another, after another, and you're working all these long hours, all these long days, and you're not taking care of yourself. You're going to hit burnout stage pretty quick. Okay. So just a little cartoon action here for you to kind of sum it up in a little picture. Okay, so helping professionals at risk. Think about all the helping professionals out there and who is at risk for vicarious trauma. Mental health professionals, you think about us, definitely at a high risk for vicarious trauma. Your medical professionals, your doctors, your nurses, emergency respond personnel, think about our first responders. I'm sure what they see, that fear of the unknown to a call, is very, very traumatic. Okay. Substance abuse clinicians, child welfare workers, crisis staff. Think about crisis staff, even if it's just a call crisis where people are calling in for crisis. Think about what they're hearing on that other line. They're hearing some pretty traumatic stuff, which can definitely take a toll on themselves. Undergrad and grad students. The reason why I put this one in there is because while I was doing this training, there was a girl that was sitting in the audience, and she was an undergrad student, and she was doing her internship at a psychiatric center. She wasn't doing it at Clarion. She was doing it one down in Pittsburgh. And she said, all the books, all the classes did not prepare me for what I was about to see. And she said, when I would do my internship, she saw people self-harming. She saw physical violence. She saw emotional abuse. And there wasn't really a lot of support, she said, back at the university that she attended. So she was like, oh my gosh, I just been through 3 years of college, and this is really not what I want to do. I was not prepared for any of this. And she mentioned that, she believes that more schools, which schools are doing a great job of now. They've hired double the mental health professionals at all universities. But she said she didn't have that support once she came back from her internship to help her deal with those traumatic experiences. And she hit that burnout stage, that secondary trauma stage, pretty quick. And she said she ended up changing her major because of that. So it can really, really have an effect on our minds as well. Okay. So play therapy. Why do you think play therapists are at a higher risk for vicarious trauma? I take you back to that picture that I showed you about what is trauma, how you can read people's facial expressions, and how most of the audience would go, oh my gosh, look at that poor little girl. Play therapists mainly work for kids, and they have to deal with a lot of traumatic situations. Through play therapy, kids tell them a lot. Kids can show them a lot through play therapy on what happened. And especially if you have kids of your own, you're going to have a lot of empathy for that. And sometimes that picture just sticks in your brain. So play therapists are at a definitely higher risk. Okay, so the prevalence of vicarious trauma. between, and this is a question that I usually ask, but I'll just click it up here, between 40 and 85% of helping professionals develop vicarious trauma, compassion fatigue, or high rates of traumatic symptoms. 40 to 85% of helping professionals. That's a lot. And if you have your master's, where you're going to be able to work with more people that have traumatic situations, about 70% of master level social workers and sexual assault therapists experience some type of secondary trauma. And then 50% of protective child service workers suffer from a very high level of compassion fatigue because they deal with the children. They're removing these children from their home. Even though it could be a dangerous situation, you're still taking that child away from their parents. All right, just some other stats when it comes to vicarious trauma. Hospice nurses, 80%. Sexual assault therapists, try to say that one real quick. Sexual assault therapists, 70%. Law enforcement, 33%. How many of you think that should be a lot higher? It should be a lot higher. I was actually doing this training at a CIG training, which is crisis intervention training for police officers. And when I brought up this slide, we had a very long discussion. And I was really unable to finish the rest of the training because we spent a lot of time on this. And I asked them that question. I said, 33% showed high levels of emotional exhaustion. Why do you think that is? Why do you think only 33% of law enforcement? I said, you guys work long hours. You work doubles. You have that fear of the unknown. You see probably more than any of us, have seen in a lifetime. You could see that in one day. Doesn't that take a toll on your body? And mostly all the police officers in that room said, I'll tell you why that's only 33%. Because as police officers, we are trained not to show any emotion. We are trained to be strong. We are trained that if we show our emotion, that we are considered weak. So we just don't do that. And I had a police officer tell me a story where he got a call. I'm sorry, that's my dog barking upstairs. He got a call from 911 saying that there was a 1-year-old that was choking, and he needed to respond to that call. So by the time, he said, to make a long story short, by the time he got to that call, the paramedics were already there, and the 1-year-old had passed away. And he sat there, and he had a 2-year-old and a 4-year-old at home, and he said, all I could think about was my kids. What if that was one of my kids? And he said, I saw the mother and father just sitting there crying and crying. But he said, I showed no emotion. Was I thinking about it? Was I trying not to cry? Yes. But he did not want to cry in front of his fellow police officers because he would be considered weak. So when he went home, he never took his homework with him, never took us home. So when he walked in, his wife said, how was your day? And he said, my day was good, just like every other day. So he said, we are taught to hold that in. And a lot of law enforcement, they do hit that burnout stage. They do hit that secondary trauma stage. So that's kind of why that number is low. It's just not reported, because if it is reported, they would be considered weak. Just probably with the same of our veterans, our armed forces, they're taught to be strong. And then 50% of child protective CYS workers. All right. So contributors to vicarious trauma. What can contribute to this? Okay. Our clients share images and feelings of grief, horror, and pain and shame. May cause you to question your own beliefs in this world. And I want to give you a story on um, what happened to me and kind of what pushed me over the edge here, because I was hitting that burnout stage. I was hitting that compassion fatigue stage. But I just want to tell you a quick story. When I was working um, at Poetic Counseling Services, I was working with a client. We'll call her Anna. And I was with this family for a long period of time. I built that trust with them, and they trusted me. And Anna was um, Anna was a girl with mental health issues, and also some traumatic brain injury, and also some physical limitations. So she had some services within the school to help her in the school. So I would, go into the school, see what was going on. I would go into the home, see how things were in the home. Um, and it could become angry and aggressive at times, but mainly because it was her way of getting out of work. She did not like to do math. She did not like to do any other work. So sometimes, she would try to use that to get out of certain situations. She was very popular in the school. It was so great to see, the kids that would walk down the hall and, say, Anna, how are you? Give her high fives, give her a pat on the shoulder. And it just lit up her face like you would not believe. Things started to change after a while. Anna became more aggressive. Um, as kids were walking down the hall, she would try to hit these kids. She would try to kick them, punch them, things in that nature. And we just couldn't put our finger on, why her behaviors were taking a turn for the worst. When she was at home, she would sit up in her room. She would not come downstairs. Usually when I came into the house, you could hear those little footsteps coming down the stairs. David's here. And we would sit there and talk about her day and things in that nature, talk about her chore chart and how she was doing at home. That kind of stopped. So, I was thinking to myself, what is going on? There's something going on, that her behaviors have changed. So even like and her behaviors were changing, not only at home, but also in the other three settings, in the school setting, in the community setting, and also in the home setting. So something was going on, but I just couldn't figure out what it was. And we, just probably came to the conclusion that, she was a senior. She didn't want to do the work anymore. So it was just her way of trying to escape, some type of work. So I got a phone call from her mother, and her mother was crying hysterically. And she said, David, you have to come to the house. Something has happened to Anna. And immediately I thought, something happened to her. I said, what happened? Is she okay? And her mom said, she's okay. She had a history of seizures, where she had to be life flighted down to Children's Hospital at times for these seizures. So I thought maybe she had, a seizure, a grandma seizure, or something in that nature. But her mom said, no, she's fine. I just need you to come to the house. Hurry. So I came to the house, and as I pulled in, she was sitting on the back steps with her husband, and they were both crying hysterically. And I said, "Please tell me, what's wrong? What is going on?" So they proceeded to tell me that the parents took a lot of vacations, so the grandparents would come over to watch Anna and her younger brother, and also her older brother. And while they were away, Grandma actually found Grandpa doing sexual acts to Anna. And this was the cause of her change in behaviors. And I questioned myself. How could I have let this happen? I've been with this family for so long. How could I not see some of these behaviors? Why wasn't I able to stop this? So I put a lot of the blame on myself, and I started to question, why am I in this field? Why am I even doing this? If I can't help this family that I've been with for years, how am I going to help other people? So you start to question your own beliefs in the world and why you should even be in this field. So I just thought I'd share that. I like to share a lot of my experiences with you just to kind of let you know. As a professional, we're trained to help our clients restore their happiness and well-being. If there is little improvement in your client, you may begin to question yourself, like, am I able to do this anymore? Am I able to help the people that I serve? So that is one part of the vicarious trauma. And then it happens because you care. We would not be in this field if we did not care. And sometimes we care too much. So some risk factors. These are some risk factors when it comes to vicarious trauma. Like we've talked about, exposure to the stories or images. Your controlled empathy, your sensitivity to their suffering. That's where a lot of times where I take this home and I sit in my bed and my brain starts running and I start thinking about the clients that I serve and what can I do? Why did this happen? Why did that happen? Any unresolved or emotional issues related to the suffering seen or heard. Impact of trauma on kids' stories. You can go down the list. Ethical pressures of maintaining confidentiality, and this is a big one. To maintain that confidentiality, if you don't have that supportive agency where they have that open door policy where you're able to talk to your supervisor, talk to your director, talk to other staff members about what's going on, you can't really bring that home. You can't talk to your wife, you can't talk to your husband, you can't talk to your kids, you can't talk to your friends because of that confidentiality. And a lot of times we just keep that inside, like that police officer did. How was your day, honey? It was fine. Same as always. If we don't have that supported environment, vicarious trauma, you're definitely at a higher risk. All right, so there was a study done on post 911. Okay, and it was done by these two gentlemen. So the study was done, those providing social services to the victims and survivors of the attack of the World Trade Center. So who was involved in this actual study? Direct rescue and recovery workers, your first responders. Those who provided therapy to those who experienced loss or devastation from 9/11, okay, and provided shelter resources to displaced families. And what they found was, okay, the areas that they looked at first was each person that was involved in this study, they looked at the level of support in their work environment. Did they have that open door policy? Were they able to talk to their direct supervisor, their coworkers about certain situations? So was it a good working environment or was it a bad working environment? And levels of involvement in the disaster. Were they the first responders? Were they the ones right there versus post-crisis workers? And these were the ones that were providing therapy who was involved in 9/11. The responders' psychosocial history, years of education and experience in the field, and then available of positive social networks that they could reach out to. And what they found was a higher level of involvement, okay? So maybe your first responders versus your post-crisis workers in the crisis paired with the person's history of trauma, okay? So did they have trauma themselves that they did not deal with, correlated with a higher degree of vicarious trauma. Okay, so this just shows that it's important to take care of yourself, especially if you've had a traumatic situation that you have not dealt with. And putting that on top of the clients that you work with and their trauma, definitely at a higher risk for vicarious trauma and burnout. All right, so this picture here, you know when you hit that burnout stage. I'm sure of a lot of us wake up in the morning and we look like this. Like, oh my gosh, I have to go to work again. What's going to happen today? Who am I going to see? What are they going to tell me? You try to maybe avoid those situations, and we'll talk about that here in a minute. But I'm sure we've all looked like this, or a lot of us may look like this each and every morning we wake up. All right, so there's 3 levels of trauma stewardship when it comes to vicarious trauma. Now, level number 1 is personal dynamics, who we are as individuals, and what is our own history of trauma and hardship, and have we addressed it? I'll go back to myself here. I had a very close family member who completed suicide. And I also, when I was a senior in high school, my best friend also completed suicide. So if I was unable to deal with my own traumatic experiences, okay, and a lot of times in this field, we hear about suicides. I'm on the Suicide Coalition in Clarion County, and we talk about suicide all the time. We hear about suicides all the time. I do a training on suicide prevention, and I hear so many stories, one after another, on how their loved one took their own life to suicide. So if I was not able to deal with that, I think I would have hit that burnout stage. I had to address my own issues related to suicide before I could help others. Okay. And then what led us to do the work that we do? What got you into this field? Something had to get you into this field. We don't do it because of the money. So something had to get you into this field. For me, it was, I grew up in Pittsburgh, and we had a lot of neighbors around us, and we were all pretty close growing up. We all the kids that were around us were pretty much the same age. And there was one of our friends, his name was Billy. Billy was a little bit different than us. Billy was a little bit slower, talked a little bit different, but we included him in all of our activities. We just thought he was, one of us. But as we got older, we could see the differences in Billy. So I asked my mom a question. I'm like, Billy seems to be different than Mark, seems to be different than Scott or Mike. And my mom sat me down and she had a talk with me and said, Billy has a disorder called mental retardation. And she proceeded to tell me all about it. And, it causes him to talk a little bit slower, not to be able to do the things that we are able to do. So that really didn't matter to us. Billy was one of us. And today I still talk with Billy. He lives in my old neighborhood where my mom lives and my brother lives. When I go down to see him, I always knock on his door. I'll go in, now we're at that age where we can sit down, we can have a beer together. So I'm still very close with him. And his mom continues to tell me each and every day, she said, "Oh, David," she said, "without those Delvo boys, I don't know where Billy would have been. You guys taught him so much. You included him in everything." So, from that moment, I thought, I want to help people like Billy. I want to be able to make a difference. So that's why I got into this field. It was a personal issue. So I'm sure you guys have the same stories as well. All right, so this is the Wounded Healers quote. Okay, People who, through their own traumatic experience, possess a greater capacity for empathy. However, their need to heal others helps them avoid contact with their own unprocessed trauma. That's where that compassion fatigue stage can come in. That's where, you're so worried about the clients that you work with that you forget to deal with your own unprocessed experiences. All right, level number 2, the organizational tendencies. Do you have that organization that is supportive? Do you have that organization that will sit down and listen to you? A lot of places don't. A lot of places don't. And a lot of places force you to deal with those problems on your own. I've worked for some agencies in the past where, when they hire you, we have an open door policy. You can come talk to us at any time, but that door is always shut, and you're left to deal with these issues on your own. So, people that have that positive organization, people that have that organization that cares about them, stats show where they experience lower levels of vicarious trauma. So that organization is very important when it comes to that. And then these 3 social factors, how does society interfere with our traumatic exposures response? People that aren't in the mental health field, okay, like say our friends, our family. And we're talking about our jobs. We're talking about things that we do. I know I hear it a lot, and I'm sure you have heard it a lot, where people will say, "Oh my God, I could never do what you do. I could never do that. That would drive me crazy. That would drive me to an early grave. I just don't know how you do what you do." And we start to question ourselves. We start to think about that, like, why do I do what I do? I have no idea. And there's not a lot of praise. There's not a lot of thank yous. There's not a lot of money compensation for what we do. So we start to question that, like, why do I do what I do? Why don't I do something else? So that plays a big part in that as well. All right, more is better. Employees often give 110% and feel more is better, especially in the mental health field, especially if you are a fee-for-service worker. You just keep piling those clients on because you're afraid that you may lose your job. That if you say no to a provider or to your boss, that you will lose your job. So we always try to give that 110%. A lot of us don't take vacations. We feel that, especially if you're a fee-for-service worker, you don't get paid if you don't work with your clients. So a lot of people will not take those vacations. They will not take time for themselves. Often leads to being overworked and just physically exhausted. And that's where that burnout stage comes in. Okay. Signs and symptoms of vicarious trauma. So these are signs and symptoms that you can look out for yourself, or you can look out for your employees as well. All right, so some behavioral symptoms that you want to look out for. Frequent job changes, okay? Sometimes people feel that it's going to be better somewhere else, but it never is. They're trying to find that perfect job. Being late for work, you go back to that picture that I showed you. You wake up every morning like thinking, oh man, do I have to go to work today? So being late, that anger, that irritability, you're just not in a good mood anymore. You're just not a happy person. Overworked, your caseload, your exhaustion, talking to oneself. That could be a good thing or a bad thing. I talk to myself all the time. It kind of helps me talk things through if I hear it and not just think it. Going out to avoid being alone, dropping out of community fairs, and that rejection from physical and emotional closeness with kids. I found this one. I recognize this in myself, and my wife and kids actually told me about this. You know, working with kids all day, working with adults all day, you put so much effort into that, and by the time you get home, to your family, to the ones that really love you and you love them, you kind of ignore them. You kind of start treating the people that you work with, your clients, better than you do your own family. I would find myself, when I was at a home doing therapy in the home, I would go outside and, we throw the football around, we throw baseball, we take a walk. I find out that the kids open up a little more when they're doing activities like that. And then I would come home and, and my son would say, Dad, can we go out and throw the baseball? Or my daughter would be like, can we go ride bikes? And I'd be like, you know what? I just got home from work. I don't want to be bothered right now. So I was rejecting, that physical and closeness with my wife and kids, and that was a big sign. So watch out for those behavioral symptoms. So this is the trouble tree. I really love this story. This kind of shows that you don't want to take your work home with you because it could have a physical and emotional effect on your family. So I just want to read you this trouble tree story. So the carpenter helping me restore an old farmhouse had a rough first day on the job. A flat tire made him lose an hour of work, his electric saw quit, and now his ancient pickup truck refused to start. As I drove him home, he sat in stone silence. On arriving, he invited me in to meet his family. Near the front door, he paused briefly at a small tree, touching the tips of the branches with both hands. After opening the door, he underwent an amazing transformation. His tanned face was wreathed in smiles. He hugged his two small children and gave his wife a kiss. Afterwards, he walked me to my car. As we passed the tree, my curiosity got the better of me. I asked him about what I saw him do earlier. Oh, that's my trouble tree, he replied. I know I can't help having troubles on the job, but one thing is for sure, troubles don't belong in my house with my wife and children. So I hang them up on the tree every night when I come home. In the morning, I pick them up again. Funny thing is, he smiled, when I come out in the morning to pick them up, there aren't nearly as many as I remember hanging up the night before. I just think that's a pretty cool story. Sometimes when you let time pass, and you're with your loved ones, you're with your family, a lot of the pressures of the jobs tend to go away. And I know it's hard not to take your work home with you sometimes, but let's really try to separate that home from work. Okay. All right, so interpersonal symptoms, staff conflicts, a lot of staff conflicts back and forth because there's no positive supports with your agency. You're always blaming others, oh, he did it, oh, she did it. Poor relationships at work, poor communication at work. You avoid working with clients with trauma history, not taking cases. I did this a lot. Sometimes, my boss would say, hey, David, can you take another client? And I would look at their psychological report. I would read over it. And if I saw that there was any physical abuse, sexual abuse, troubles in the home, I would say, you know what? I can't do this. I can't take another person like this. So it would actually, even though I might be the best therapist for that case, and it would actually be hurting that person, I'd be like, I just can't deal with all this trauma of all these kids. So you kind of avoid working with people with traumatic experiences. Changes in relationship with colleagues, having that rewarding relationship becomes difficult. Symptoms affecting personal and values. Your dissatisfaction. You're always negative all the time. You have that loss of interest in friends, loss of interest in family, loss of interest in what you enjoyed. You really look at yourself like as a depressed person, and you become depressed. And think about all the signs of depression. These are all signs of depression. You become seriously depressed. And that can be a dangerous thing, if you don't recognize that seriousness of your depression. Okay. Job performance, low motivation. You have that increased in errors. You avoidance of job responsibilities. Like, you ever hear that one coworker that says, "That's not my job. I'm not doing that. That's not my job description." You have that lack of flexibility. Okay, so these are just some job performances. So you can see where vicarious trauma really has a powerful hold on not only your family life, but also your job life as well, your employment as well. So countertransference, professional displacement of emotions onto patients. So, if you are depressed, if you are irritable, if you are angry, you start taking that out on your clients, and that should not happen. Okay. You can just kind of read this and follow down. Power struggles with clients, allow clients to take care of him or her. You just don't care anymore. And let me tell you this one about fears clients and avoids triggering anger. So I was working with this one family. Okay. And again, I was working in the house. They had some transportation issues where they couldn't get to the office, so I did a lot of therapy in the home. Good family, but I kind of got burned out after a while working with them. They were the type of family that was very loud, abrupt, abrasive. So, as I was coming down the street, if I had my windows open, I could hear the screaming and the yelling coming a half a mile away. I would pull into the driveway, and I would actually sit there in my car and think to myself, how could I get out of this? Can I fake a phone call saying my wife is sick and I need to go home? I would come up with all these things in my head, so I didn't have to go into that house, which is wrong to do. So I'd work up enough energy. I'd go and knock on the door. And as soon as I knocked on the door, Mom would start yelling and screaming, "Oh my God, David, Colin won't do his chores. He didn't do his homework. He's failing. He pushed his little brother. He pushed his little sister," just on and on and on and on. And I would just sit there like rubbing my temples like, "Oh my God, why am I even here?" So, so I would sit there, they would get quieted down, and I'd be like, what do you want me to work on today? What happened today? What are things that we can address? Then she was like, "He's not doing his chores. His room is a disaster. I told him to pick up his room 5 times and he's not doing it." Meanwhile, there was not a lot of positive modeling in the home. Mom did not keep a clean house. There were dishes from maybe the week before, flies, garbage all over the floor. And one of his things was, "Why should I have to clean my room when you don't do cleaning either?" Which he was right. And we did end up working on that. But so what I would do was I would be like, "All right, Colin, let's go back to your room, to avoid, any further consequences of your mom yelling. Let's just go back there and do what she said so we could avoid all that." So we would get back to his room. Very slow kid, didn't want to hurry a lot. So what I find myself doing was to avoid all the screaming and yelling from Mom and from him, who would end up cleaning his room. I would do it. I would do all the work for him, so I did not have to listen to that yelling and screaming. Was it helping him? No. Was it helping the mother? Was it helping the whole situation? No. It was teaching him the totally wrong thing that I was trying to work with him on. And sometimes I would have to self-check myself like, oh my gosh, maybe I should put somebody else on this case because I am not helping this matter whatsoever. So that is a big thing. You have to take a step back and actually think if you're helping the situation or if you're hurting that situation. Okay. All right, I love this saying. I'm so stressed out about being stressed out that I can't even remember why I'm stressed out and it's stressing me out. So basically, everything is stressing you out. Everything when it comes to vicarious trauma. Okay. All right. So this is the compassion satisfaction. This is the professional quality of life scale. Okay. So, feel free to do this on your own time. Like I said, just Google professional quality of life scale. They'll come up, download the questions, follow the directions for the scoring, and it can really show whether you're in that burnout stage or that secondary trauma stage or that compassion fatigue stage. Okay, so this is what the tests look like. So there's 30 questions, okay, and then there's a scoring card that you follow the scoring, and then you break it down, and then it actually shows you your score if you're in that burnout range, secondary trauma range, compassion fatigue stage. Okay, so I recommend you do it if you're that visual person and really needs to see it. I kind of self-check myself every once in a while, and I'll do this test, just on my own to see where I'm at. It kind of reminds you that you have to get back to that self-care. You have to start taking care of yourself. All right, so the work that you do is hard. It is, and I commend each and every one of you for the work that you do. It is hard work. It's not easy work. We don't get the praise. We don't get the thank you. We don't get sometimes that self-reward from this job. So you need to start taking care of yourselves, okay? And self-care isn't selfish. I tend to tell people, be selfish sometimes, take care of yourself. It's not selfish by maybe taking a vacation day once in a while, telling your kids to leave me alone for an hour while I take a walk, while I exercise. Just be by yourself and do the things that you used to enjoy or that you still do, that you just don't have the time with. And a lot of people say, I don't have the time. I don't have the time to do anything. Well, that's not an excuse, okay? So I put some things in here that you can do that takes 2 minutes, okay? Breathe. Sometimes we forget to breathe when we're in a panic situation. Breathing can really help. It slows down your heart rate. Stretch. Sometimes I'll just stand up, stretch for about 5 minutes, makes you feel better. Acknowledge one of your accomplishments. What did you accomplish for this day? What gave you some positivity? Spend time with your pet. Spend time with your family. Share a joke. Those things only take 2 minutes. 5 minutes. Listen to some music. Step outside for some fresh air. Go outside, take a little walk, even if it's just for a couple minutes, but getting that fresh air, getting some light, seeing some light can make you feel better. Enjoy a little snack, cup of coffee, cup of tea, things in that nature. That only takes 5 minutes, 10 minutes. Evaluate your day, write in your journal, draw a picture, listen to some soothing sounds. 30 minutes, get a massage, exercise. Guys, exercise, I can't express it enough how important exercise is. Exercise is an evidence-based activity that shows that lowers anxiety, that lowers depression. Sometimes, you say, I don't have time to exercise. It doesn't have to take 30 minutes. Take a walk, just do something to get that heart rate up. Eat lunch with a coworker. A lot of times in this field, I hear people say, I don't even eat lunch. I just work straight through lunch. Spend time in nature, go shopping, just do some things, okay? in this 5-4-3-2-1 grounding exercise. I learned this exercise. It was actually from a Army veteran who suffered from depression and suffered from severe anxiety. And he would have a lot of panic attacks. And he used this grounding exercise that he said really helps him. And it only takes a couple minutes to do this, okay? So if you're feeling overwhelmed, if you're feeling depressed, if you're feeling like you may start to have a panic attack, your anxiety is really running wild, I want you to sit down in a chair. Just sit in a chair, or even stand up. It doesn't really matter, okay? But the 5-4-3-2 grounding is, number one is 5 things I can see with my eyes. So you want to look around and name 5 things that you can see with your eyes, okay? 4 things that I can feel. So look around you. 4 things that you can touch. 3 things that you can hear. 3 things that you can listen to. I know a lot of you probably heard my dog barking throughout this. I can hear my dog. I can hear the wind blowing outside right now because it's very windy. And I can also hear my wife walking upstairs, okay? 2 things that you can smell, maybe smell the grass, maybe smell some flowers. And then 1 thing you can taste, okay? And the gentleman said that this really works. I've tried it. I've done it. It's a distraction. It causes your heart rate to lower, and it causes you to kind of bring you back to reality. The veteran said, when I do this exercise, when I get overwhelmed, he said sometimes there's a lot of triggers out there that trigger him being back in Iraq, or wherever he was, but he would sit in a chair, and he could feel his feet on the ground, so he would be like, okay, my feet are on the ground. 5 things I can see with my eyes. I see, a tree. I see a car. And it brought him back to reality where, like, he was, okay, I'm not overseas. I'm not at war. I'm back in the United States. There's no reason to worry. Use this on your clients that you work with. It's a good coping skill. It's a good way to do this, and you can do this exercise anywhere. If you're out and about and you feel overwhelmed, you can do this exercise there as well. Okay. Connecting with others, people who feel connected with others are happier and healthier. So go to places where you have that connection with people, okay, that you're not isolating yourselves. Stay positive. People who regularly focus on the positive in their lives are less upset and painful. So surround yourself with positive people. Stop surrounding yourself with people that are always negative, always looking at the negatives. If you're hanging around those type of people, you're going to be doing the same thing, okay? So think of some positive experiences you have had in your life. Start thinking about the positive rather than always the negative. And get active. Research shows that being active can reduce depression and anxiety. So what are some ways that you can stay active? Exercise. Get that exercising in. Get enough sleep. I know this can be difficult at times, but sleep is important. Not getting enough sleep can cause weight gain, accidents, memory loss. It can put you in a bad mood. It could cause a strain on your relationships at home and work. So you want to start thinking about things that you can do to help ensure that you get a good night's sleep. Maybe not drinking caffeine after 5 o'clock. Maybe exercising, not eating past 7 o'clock. These can play a big part in you not getting enough sleep or you getting the sleep that you need. Positive emotions can boost your ability to bounce back from stressful life. So go back to those hobbies. Go back to those things that you once enjoyed. I used to love to play golf, but my life just got so busy with kids, with work. I kind of got away with it. I used to be in a golf league where every Wednesday we would go play golf. Afterwards, we'd go out to eat. Have a couple beers, get reattached. How was everybody's day? And I stopped that. But I did go back to it. I'm like, I have to start taking care of myself. I have to start doing things that I enjoy. I have to start doing things for myself and stop doing things for everybody else. I was that person that could not say no. I was that yes person. Yes, I can do this. Yes, I can do that. Yes, I can do this. And it became overwhelming, and I forgot to take care of myself. So go back to those hobbies that you once enjoyed. Eating healthy, can boost your energy, decrease your chances of getting sick. I travel a lot through my job, and sometimes you're on the road and you get hungry and you're like, oh man, I'm gonna get a McDonald's and I'm gonna get that big old quarter pounder with cheese and fries. It tastes good going down, but afterwards you're like, oh god, why did I do that? I'm so bloated, I'm tired, I don't feel good. So if I would go on long trips, I would pack healthy snacks, carrots, pretzels, and cheese, proteins that I could eat. I kind of cut out that fast food, and it really helped. It went a long way. Deal better with hard times. People who tackle hard times get support in tough situations tend to feel less depressed. So who can you depend on in tough situations? Who are your positive support systems? Your friends, your family. Go to them. Tell them you're having a hard time. Go back to those coping skills that you used to do that used to help you through that. Use that 5, 4, 3, 2, 1 grounding technique. Okay. And then this is a big one. Just because we're mental health professionals or we're helping professionals in general doesn't mean you can't go get the help that you need. Okay. More than 80% of people who ask for help with depression or anxiety and other mental health disorders do improve. So know the resources in your community. Where can you go in your community to get help? And don't worry about that stigma. Don't worry about what other people are going to think. Worry about yourself. Be selfish when it comes to that. Workplace self-care. Take breaks during your lunch day. Take time to chat with coworkers. Arrange your space so that it's comfortable. Okay, get regular supervision, consultation from your agency, that peer support. And I know some of these can be difficult at times, but if you do have that positive agency, maybe you can bring some of these recommendations up that they don't have in place. Okay, so that workplace care. Escape, rest, and play. Get away from it all. Do things you find relaxing and engage in those activities that you used to enjoy. Okay. All right, guys, just hang in there a little bit longer. We're almost done. I used to do this, as mental health professionals. We create treatment plans for our clients. We tell them what they need to work on, what their goals are, what their short-term goals are, what their long-term goals are, what interventions that they can use, what warning signs they need to look out for in themselves. Do that for yourself. Make a treatment plan for yourself and follow that treatment plan. Hang it up on the wall. Are you meeting your long-term goals? Are you meeting your short-term goals? Come up with interventions that will help you through hard times. If we can create treatment plans for our client, why can't we create treatment plans for ourselves? Okay? Just a simple way. To keep the lamp burning, we must keep putting oil into it. That was a Mother Teresa's quote. I love that quote. All right, so how can your organization prevent vicarious trauma? Obviously, your workload. If you're getting burned out because of your workload, let them know about it. Work environment. Do you feel safe? Do you feel comfortable? Are they providing you with education and trainings for your job? that group support, that group supervision. These are all things that your organization can do. And I have these in there because this is what Clarion Psychiatric does. Sometimes it's mandatory that we take trainings for self-worth trainings, for wellness trainings. Supervisions are mandatory, where we meet with our supervisor once a week and we talk about our stress, we talk about our jobs. We're able to do that. We have that open door policy. Debriefing, why is it important to following a crisis situation? So, if you're one of those people that experience types of trauma while you're out on the job, make sure that your agency provides you with a debriefing. So for every call that we get on our hospital, whether it's on the floor, whether it's an aggressive patient, things in that nature, after every code is called, the head nurse, our CEO, will actually sit down with the persons or the person or persons that were involved in that code and actually go over and talk to them. How could we have done things differently? What were some positive? What were some negatives? Is everybody okay? Does anybody want to express how they feel right now? It gives you a time to talk. It gives you a time to debrief those thoughts, to think about those thoughts, to share those thoughts, so you're not keeping that all inside. So post-crisis debriefing is very important, being able to get off your chest what you just saw and what you heard, okay? So these are some of the things that we do at Clarion Psychiatric Center. Every other Thursday, it's facilitated by our clinical director. This allows staff to discuss their feelings, facts, perception of a crisis situation that occurred. So anybody that wants to come, it's every Thursday, maybe in between shifts, like at 3:30. Whoever wants to come can come. They sit there and they talk about their feelings related to the jobs, things that they saw throughout the day. We have what's called a shrink wrap. It's a monthly meeting with our medical director, and staff have the open forum. They can talk about anything. Anything they want to talk about, they can talk about. And we do have our doctor there. If issues need to be addressed, he can address them at that time. And we do have our employee assistance program as well that we offer. So that's all, guys. Starting to lose my voice. So like I said, if you have any questions about this training, please email me. You can write down my email. My email is David, that's DAVID dot, and my last name, Delvaux, DELVAUX, at uhsinc.com. Okay. Like I said, if you have any questions about the training, if you need a certificate for this training, I can email you a certificate saying you completed this training. And if you would like me to come to your agency and provide some of these trainings for your staff, email me. We'll set up a time. We'll set up a date when I can come out. Okay. All right. Let's see here. Okay, I just want to end. This is called, his name is Kid President, and he does this motivational speak here. It's just a good way to end on a positive note. So let me just pull this up here for you guys. Hopefully I have it. Yeah, here it is. Okay, hold on. I'm going to move myself up into this corner.
I think we all need a pep talk. The world needs to stop being boring. Yeah. Boring is easy. Everybody can be boring, but you're good at that. Life is not a game, people.
Whoop, sorry, guys. Oh, hold on. Okay.
Life isn't a cereal either. the same team? I mean, really, right? On your team, be on my team. Just like people, you got air coming through your nose. You got heartbeat. That means it's time to do something. I told them, two roads diverged in the woods, and I took the road less traveled. It hurt, man! Really bad. What? Sports? In class? Bullets broke. Ah! Not cool, Robert Frost. But was there more word to that? I will be the one that leads to awesome. It's like that dude Jeremy said. Don't stop believing. Unless you dreams. Then you should get better. I think that's how it goes. Get a better friend and keep going. Keep going, and keep going. What Michael Jordan that quit? Well, he didn't quit. No, he retired. Yeah, that's retired. But before that, in high school, what if he quit when he didn't make the team? He would never make Space Jam. And I love Space Jam. What will be your Space Jam? What will you create will make the world awesome? Nothing if you keep sitting there. That's why I'm talking to you today. This is your time. This is my time. It's our time. You can make every day better for each other. If we're all on the same team, let's start acting like it. We got work to do. Proud about it? Oh, dance about it. You were made to be awesome. Let's get out there. I don't know everything. I'm just a kid. I do know this. Somebody's used with the hands that grow up in these experiments. So get to it.
Wish I could dance like that.
Create something that will make the world awesome.
Okay, so let's go back to our presentation here. Okay, so like I said, guys, thank you very much. And please contact me with any questions, certificates of this training, or if you would like to take set up another training in person. And please feel free to go on our website as well to download 3 of the other trainings that we have. And I want you guys to have a great day, and remember to take care of yourselves, okay? And that's what this training was all about. Take time to be selfish for yourself, because without you, our clients would not receive the services that they do. Thank you for your work. I know it's tough sometimes, but I really want to thank you for all that. And I want to thank you for your time today. So I hope everybody has a good day, and I hope to see you soon. Bye.